Welcome everyone to this week's call. As always, this is for your use. Whatever you learn on this call, please check with your primary provider before implementing anything we recommend on this call. All information is accurate to the best of our ability up to this date. That disclaimer is not necessarily as relevant to today's call because today I want to talk about adverse childhood events and their impact on our long-term health risks. This morning, I had a consultation with a man who is 39 years old, and he had reported lifelong IBS, or irritable bowel syndrome with constipation, as well as lifelong anxiety. And he told me that his first memory of his life, the first thing he can remember, causes PTSD. And so, one, that makes me sad for that person because you if that's your first memory, that's a tough way to start. And it makes me sad for that person just from a human standpoint, but then also from a knowledge standpoint, because there has the longest study ever done following people from childhood into adulthood to investigate what causes chronic disease is called the ACE study, or the Adverse Childhood Experiences Study. And that study followed over 17,000 children for 30 years to look at how does abuse impact long-term outcomes in health. And so what they looked at was childhood physical abuse, emotional abuse, sexual abuse, witnessing domestic violence, growing up in a household with substance abuse, mental illness, parent divorce, and or a household member in jail. So all of those things are considered adverse childhood experiences. And what they did was they followed this cohort of people, and they tracked ACEs, adverse childhood events shortened, or experiences shortened to ACEs, and 0 to 8 or 0 to 10, depending on which questionnaire they're using, is the score you could have. And so the higher the number of your ACEs, the worse the outcomes. And so let me find it here. So here's like a summary graphic of it, or fact sheet. And basically, adverse childhood experiences shows that trauma in childhood increases risk for autoimmune disease, chronic disease, health problems later in life, and future generations. The effects of childhood trauma are not just psychological. Trauma alters brain development, function, and structure, autonomic nervous system regulation, which is your balance between stress, fight, or flight, and rest and digest, health, and healing. Adverse childhood experiences also alter physiology, your stress responses, as we talked about, and gene function via epigenetics. So epigenetics is your experiences, your lifestyle, the environment's impact on turning a gene on or off. So you could have the BRCA1 gene that increases your risk for breast cancer, but as long as it's in the off position, you're not going to express breast cancer. It's the lifestyle, say you're smoking or ACEs or some other factor that turns that on, that now that breast cancer is expressed in the individual with that gene. So ACEs become very, very important for us. And this fact sheet broke down numbers from the study and said 63% of the US population reports at least one adverse childhood experience. And, when you get to 25% of people report that they've had 2, 12.5% report that they've had 4 or more. Why is that important? Life expectancy. Your life expectancy is 20 years shorter if you have 6 or more ACEs, and premature death rate is 2 times higher with an ACE score of 4 or more. Autoimmune disease is a 20% increased risk with each additional ACE point. So from an ACE score of 3 to 4, that person has a 20% higher risk, the one with 4 than with 3, and an 80% higher risk than someone with 0. And 70% increased risk of hospitalization for autoimmune disease if you have 2 or more ACEs compared to no ACEs. So it doesn't take much. Say, you grow up in a home where your parents are divorced, and maybe one of them's a drinker, or one of them is verbally abusive to you, or one of them has mental illness. So this test was done in a hospital setting. And so 63% of the population in a hospital setting reports this. Now, what if we did outpatient tests? Like, so we went to every chiropractor and naturopath and medical doctor and therapist office and did the same thing. It's likely that this 63% of the population number would be much higher. So this is a massive, massive area of importance in terms of health on the individual level and the national level. And so everywhere they look, it has an impact. So this study was in 2009 in the journal Psychosomatic Medicine, and they wanted to look at ACE outcomes with autoimmune diseases specifically. What they found was that compared to people with an ACE score of 0, people with an ACE score of 2 or more were at that 70% increased risk of hospitalization with a Th1 immune dominance, 80% increased risk of hospitalization if you have with a Th2 dominance, and 100% increased risk of rheumatic diseases. So it's a huge factor that the earlier in life you're exposed to adverse childhood experiences, the higher the risk of poor health outcomes as you get older. Childhood traumatic stress, they concluded, increased the likelihood of hospitalization with a diagnosed autoimmune disease decades into adulthood. And again, some people fall through the cracks because some people are never hospitalized for it. So again, these numbers are likely to be higher if we studied outpatient clinics. 10 years later, so more recently, in the Journal of Preventive Medicine, these authors looked at how do ACEs impact risk of chronic disease in young adulthood. So autoimmune disease falls under the chronic disease umbrella to also go along with cardiovascular disease, asthma, lung disease, all kinds of different things. So they said, or they found, that the prevalence of 4 or more ACEs was highest in the youngest respondents. And so the age groups were 18 to 34, 35 to 54, and greater than 55 years old. So 20% almost of 18 to 34-year-olds report 4 or more ACEs in this study. And this is out of almost 87,000 people. So that's a massive number, and that's saying, hey, our youngest generation is the worst in terms of ACE score. So they've been subjected to the most abuse, which isn't, or most broken homes, right? Which isn't really surprising to us if we look at society and the number of the divorce numbers and the single parent numbers. But it's sad, and it's also not good if you project that into the future in terms of healthcare costs. There's a dose response gradient between ACE score and outcomes. So the higher your score, the worse your outcomes. And among younger respondents, those reporting 4 or more ACEs had 2 to 4 times risk for each chronic condition and poor health status compared to respondents with no ACEs. So again, there's a 200 to 400% increased risk of chronic disease if you have 4 or more ACEs compared to someone with 0. Was this the study? Okay, so we'll keep going here. So that was one thing I spoke with the gentleman I was consulting with this morning about. I said, hey, the first thing to jump off the page is that if I never meet you again or see you again, this might be a connection for you that was never put together for you. Is you've had lifelong IBS and lifelong anxiety, and there's this biggest study ever done showing that childhood stress increases your risk of chronic disease outcomes. And it looks like, if you start life with PTSD, you're going to be accelerated in terms of chronic disease progression unless someone nips that in the bud. Well, he proceeded to tell me that he lived in that household and continued abuse until he was 17. So they didn't get on top of that, and his health continued to deteriorate. And then I went next level and said, okay, well, let's try and figure out chicken or egg. Was it IBS first or anxiety first? And it really doesn't matter in his case because he has both now and it started so early, but it's fun to do the mental exercise. So here's a study from Nature Reviews Immunology in 2017. This is a landmark study, and if you're a nerd, you should read this one. Like, this should be on your Christmas list of studies to read, because it's just awesome. But one key thing relevant to our discussion is that there were 2 studies done that looked at trying to tease out gut-brain to brain-gut axis and what does what, right? And they made the connections of the gut is connected to the brain and vice versa. And so what they did was they looked at individuals with functional gastrointestinal disorders, which would be like GERD or reflux or IBS. And they wanted to know, does having GERD increase risk of having a neurocognitive complaint later, like anxiety, depression, those things? So they studied about 2,000 people, and they followed them for 12 years. At the start of the study, everyone had IBS. No one had neurocognitive complaints. After 12 years of no treatment, just following them, they found that 2/3 of the people with IBS developed neurocognitive complaints, so anxiety or depression. They did the same thing in reverse. They studied people with only anxiety and depression, neurocognitive complaints, no IBS or GI complaints. Don't treat them, but follow them for 12 years. And after 12 years, 1/3 of that group develops IBS. Okay, so it could start from either end, and a very high number of individuals who have either GI or neurocognitive complaints and aren't treated or don't improve their health are going to result with the other end of that loop present. So I said to him, hey, you start life off, your first memories PTSD driven, so there's an ACE. Okay, you do that for 17 years, there's multiple ACEs in there. Then who knows with him which was first? Probably with PTSD, the neurocognitive was first, and then the GI stuff developed next. And so, you know, this is important because if we start life with ACEs, this study separately would say, hey, 1/3 of those people are likely to end up with GI complaints because they started life with an adverse childhood experience score that probably affected neurocognition. And we can see that it increases risk of suicide attempts in life as well. So again, if we start life with abuse, we have more abuse. It's fairly intuitive that people that undergo more abuse are likely to have higher suicide attempts in their life. But I thought this was relevant in the case of COVID right now, because doctors all over the country are saying there are secondary effects to the lockdown that can't be necessarily measured directly or that weren't thought about before the lockdown was instituted. So if you've seen the video of Dr. Erickson, the doctor from California that took the CDC statistics and went viral and showed, hey, this is what's happening. He said that in his 7 clinics across the state of California, he had been seeing increased child abuse, increased spousal abuse, increased alcoholism, and increased suicides. And so if that's going on because of lockdown, then we have a whole generation of children who over the last couple months have probably added an ACE or 2 to their score if they were in one of those homes where there was abuse or molestation or domestic abuse or addiction or something like that. So that may increase the suicide risk as well, long term. And so why? Like physiologically, why would this increase the risk? And this ties into the stress caused by the abuse or the divorce or the parent going to jail or whatever. And it's strongly documented that stress drives inflammation, and inflammation is the fundamental lowest common denominator that's going to lead to expression of whatever each of our weak links is physiologically. So in one person it's MS, maybe in me it's heart disease, maybe in someone else it's cancer, but that chronic inflammation is the lowest common denominator for all of us. So if someone is abused to start out life and that's their first memory, you know, you're ramping up the stress response, that fight or flight response. And the stress response is supposed to be short term, supposed to be acute, supposed to be, oh, there's a tiger chasing me. I'm going to run or fight it. 15 minutes later, if I'm alive, I either outran it or I killed it, right? So then I can calm down, relax, go back to pulling berries and tubers out of the ground if we're thinking of our hunter-gatherer ancestors. Well, in our society, if I'm a child and I'm abused and I flip that switch and I don't feel safe, and now every day I'm wondering, is this going to happen again? Well, that tiger's there 24/7, right? Or the threat of the tiger, even though the tiger isn't real, or in this case, the threat is the abuse, and that is real. Well, now you're creating a vicious cycle in this physiology. So it's okay to break down your body, to suppress your immune system, to suppress your sex hormone function acutely for a short term to run away or fight a tiger. But 15 minutes later, we shouldn't be suppressing those things anymore. We want to be healing and growing, anabolic, not catabolic. Well, if I'm living for 17 years in an abusive home, I'm living or running for 17 years from a tiger. So I'm suppressing my immunity, I'm suppressing my sex hormone function, I'm affecting my physiologic development and affecting my brain, because that chronic body inflammation also leads to chronic brain inflammation. Okay, so we could have body inflammation driving gut or lungs or heart or skin or any tissue. And then if that becomes neuroinflammation, now we're promoting anxiety, promoting depression, promoting bipolar, promoting whatever our neurocognitive weak link is. And study upon study every day is published that depression is not primarily a deficiency of serotonin. It's primarily a brain inflammatory issue. And long-term brain inflammation may result in serotonin deficiency. And this is why 55% of people on selective serotonin reuptake inhibiting medications aren't helped by them, because it's probably brain inflammation, not serotonin deficiency. So this is just one small window into what would the physiology be behind increasing numbers of ACEs and increasing risk of chronic disease, autoimmunity, suicide attempts, etc. So as clinicians and just as people, we need to be aware of how we're treating everyone, obviously, but especially our children, because our children, they look to the adults for safety. And so if they're taught that the adults that they trust the most in their whole life are the adults that are supposed to love them the most in their whole life, if those adults are abusing them or hurting them or making them feel unsafe, then now physiologically for the rest of their life, if the cycle isn't broken, their guard's up and they're creating unhealthy physiology because of a learned response. So I hope that makes sense to you, and I'll open it up for questions and comments now.
Sad. It's just really sad.
Yeah, I agree. And so, we can impact what we can impact. We can share this information with people, and we can also take people under our wing as best we can. So I can think of, children outside my home, but that are around my home that could use, just some love. You don't know how important something you might say or do with that child today could echo into the future for them. They might never hear a positive thing at home, and you could say a positive thing or just smile or just give them a hug or just welcome them to dinner with your kids, and that's like life changing, or could be the first step to life change, right? So now maybe they hang out with your family more just because they feel loved at your home. So we can be lights to these kids, and we might not even know it. You could have kids in your house that are friends with your children that are being abused, but cover it up well, but they're there because they're drawing off the light or the love that you're sharing with them. So just doing our best as humans to love other people.
Yeah. They can just see that what they live in every day isn't normal. They might think it's normal, but it's not normal.
No, it's not.
It shouldn't be normal.
Right. Right. Unfortunately, it's like if in that person's instance, it was normal for 17 years, like that was normal to him, right? Because his first memory started there and it continued. So hopefully, once he left the home, he found out that that was not normal and got exposure to normal, right?
Right.
Yeah, Linda, what do you?
A lot of things. First, my first response is knowledge is always power. So no matter, the more we know about these things, the better it is. You can understand it, you can help it. The more people that understand anything, whatever it is, it is a helpful thing. So there's that. And then my attention was actually drawn more to those people who have these events, but don't suffer these
Yep.
consequences physiologically.
Mhm.
And I'm curious to know what, if anything, has been any hypothesis or research has been done with that, because some people end up Bowery bums and other people are Maya Angelou.
Yeah.
And, adversity, it was in spite of, not because of.
Yeah. Yeah. I'm not aware of studies on that side of things. I hope they're there. But what I would say is probably, or hopefully, a couple of things. There's probably people that just constitutionally don't, like, they're not going to give in to that, right? So some people are just fighters, and so that's there. And then there's probably people who latched on to someone in their life that was a light, right, and that was positive, and that was able to, again, show them enough light or love or whatever it is to break that cycle or help them not go down that road. But I don't have a study answer for you on that one.
But it also occurs to me that physiologically, or you're just looking at like biomarkers and things, as we learn more about genes, there may be certain genes that the conflux of certain things make you more predisposed if you have this number of them in that many places versus somebody else. You have the same events in a siblings in a family, but you don't take them and go forward in the same way.
100%. Yep. So you can have the genetic susceptibility, right? And then the triggering event happens, and you're good because you don't have the genetic susceptibility, but your sister is set up to not respond as well or not be able to respond as well. Yeah. And so that can be a genetic, so a hard piece, and that could also be an epigenetic piece, so environmental triggered.
And personality, things we've yet to even figure out or discover that changes the tenacity of a person, which will absolutely change the rest of the factors.
Yes, 100%. So there's in my book, I talk about the exposome, and the exposome is a field of science that's everything you've ever been exposed to from conception forward impacts your health picture. So yeah, there's you couldn't do an exposome based study because there's so many factors, and if you're trying to look at 17,000 people and all the different factors, your head will just explode. But absolutely, there's some higher probability ones that you could look at and try and control for, but there's always going to be things that we can't control for.